WBC. What is the other name of WBC? Thrombocytes? Leukocytes. What is the function of WBC? Main function? Immunity. Which WBC is involved in the immune function? Macrophages. Is there any WBC called as macrophages? Neutrophils and monocytes. Okay. Which is modifying itself into macrophage? Monocytes. In which place you will find and tell it as a monocyte and macrophage? If you are finding the monocytes inside the blood vessel, that is monocyte. When you need the macrophage, when there is any cell damage, cell injury, in order to engulf the foreign substance, the monocytes will modify its structure and it will come towards the cell membrane. There you will term it as a macrophage. And what is the function of basophils? Basophils. What is the mast cells? Mast cells. Which is modifying as mast cells? Basophils. When the basophils in the blood vessels, it is called as basophils. If it is coming out of the blood vessels and it is encountering something, that is called as mast cells in the periphery. So within the blood vessel, if the basophil become mast cells, then it will release the histamine. That histamine will go to the entire circulation. It is not happening only in the place where the allergen is present, irritant is present. You are releasing the histamines from the mast cells, the modified form of basophils. This is the mast cells. Okay, so that is few points. So now we will see the proper WBC. White blood cells called as leukocytes. It is basically categorized as granulocytes and agranulocytes. Those which is having the granules, they are called as granulocytes. If there is no granules, they are called as agranulocytes. So these granulocytes has nucleus which is lobed. You have lobes in the nucleus. Usually cell and the nucleus we will see. But in this case, you have the cells with different shapes of nucleus, either like this, bilobed shape, or you have multilobed shape, or you have like this. Okay. So neutrophils, eosinophils, basophils, they are coming under granulocytes. They have lobes in the nucleus. They have granules in the cytoplasm. And agranulocytes, the cytoplasm is clear because there is no granules and there is a single nucleus, no lobes. It includes lymphocytes and the monocytes. This WBC we will consider in case of any type of infections. And the most common laboratory parameter which we will prescribe, which we will order is CBC and DC. In CBC, you will give DC or DLC, differential count or differential leukocyte count, which will give you the WBC percentage. This will make us to encounter what kind of infection it is. Okay, so that is what we are going to see. So this is how you will have the formed elements of the cell. So erythrocytes we have seen, platelets we will see later. So now you see only the WBC, neutrophils. So neutrophils, it is multi-lobed. The number of lobes is going to give us, identify the age of the cell. Okay, and then basophil, usually it is S-shaped nucleus, bilobed, and it will have the string attached like this, and it will remain S-shaped. So this is basophil. And eosinophil is also bilobed, but it is remaining in a headphone shape or dumbbell shape. Okay. In most of the cases, you will not see the S-shaped nucleus of the basophil. But in microscopic view, how will you identify whether it is a basophil or a eosinophil? Is because of the presence of granules. Among the granulocytes, it is having granules. Those granules itself is divided into fine granules and coarse granules. Fine granules in the sense it is very, very small. If it is a coarse granules, it is very bigger in size. You see the neutrophil, whether it is fine granule or coarse granules? Fine granules. You have a small fine granules and it is multi-lobed, so you can identify it as a neutrophils. In case of basophil, see, it is coarse granules and the granules is present over the nucleus also. You cannot see the nucleus itself because the granules are filled over the nucleus itself. But in case of eosinophil, you can see the nucleus clearly and it is also a coarse granules. Okay, so this is how you will differentiate microscopically between the eosinophil and the basophil. And now coming to the lymphocyte. You have a big nucleus. Only a thin rim of cytoplasm is seen. The nucleus covers almost the entire size of the cell. So this is the cell. Almost the entire size of the cell, you will have the nucleus. Okay, round shaped nucleus. Only a small thin rim of cytoplasm is visible. Okay, and in case of monocyte, it is also agranulocyte. You have a kidney bean shaped appearance of the nucleus. Okay, so this is how you will find the structures, and this is called as Arnett count. This is the one which is used to identify and count the lobes of neutrophils. Neutrophils is multi-lobed, right? You can have 3 lobes or 4 lobes or 5 lobes. So the number of lobes is going to determine the age of the cell. Just remember this name, Arnett count. It is the count which is used for identifying the lobes in the neutrophils. So all these divisions, no need for your level. Okay, clear? And the variations. When there is increase of neutrophils, you call it as neutrophilia, mainly in case of pyogenic infections. And in case of appendicitis, it is a inflammatory condition because of accumulation of infection in the appendix. And then in case of empyema, pneumonia, all the infectious cases, you will have increase of neutrophilic count. And in case of metabolic disorders like diabetic acidosis, chemical poisoning, whooping cough, what is the causative for whooping cough? Pertussis. And in case of myocardial infarction, malignant neoplasm. So all these conditions increases the neutrophils. The conditions which decreases is aplastic anemia. What is aplastic anemia? Anemia due to defect in the bone marrow. And when there is a radiational defect by the X-ray, drug toxicity, typhoid or viral infections, that decreases the neutrophils, called as neutropenia. And now coming to the eosinophils. And this eosinophils also have its role in engulfing the antigen as macrophages. And then it is also engulfing the antigen antibody complex. So in which condition eosinophil is increased? Mainly during allergic conditions. In allergic conditions, release of histamines increases the eosinophilic count. So mainly, and also during the parasitic diseases. If it is due to bacterial, you will encounter increase of bacterial increases. Which one? Bacterial infections. Increases what? Neutrophils, parasitic infections, eosinophils. In case of tuberculosis, lymphocytes will be increased. Okay, that is one specific exceptional case. So eosinophilia seen in asthma, hay fever, the allergic condition, and tropical eosinophilia, allergic skin disorder, and parasitic infestations increases the eosinophilic count. If you are injecting with steroid injections, eosinopenia will take place. And in case of Cushing syndrome, eosinopenia will take place. And the other one is basophils. Basophils, mainly the allergy along with the mast cells. So the modified form of basophils is the mast cells which releases the histamines. And now coming to the variations in case of chronic sinusitis, basophilic leukemia, tuberculosis, chickenpox. Some few exceptional cases you will find basophils. The normal count of basophil is less than 1%. So you will not see even a single basophil when you are ordering the CBC, differential leukocyte count, normally. If you find basophil, it indicates the presence of allergic substances, mast cell has been enhanced. That is the indication if you find basophil count. And the lymphocytes, see this is, can you differentiate? The thin rim of cytoplasm only is visible over here. So that is how the organization is present. And the lymphocytes is of two types, B lymphocytes and T lymphocytes. This B lymphocytes have its major role in the production of antibodies as plasma cells. And this is mainly processed in the bone marrow. And T cells, see the B indicates bone marrow, T indicates thymus. Okay. And this, since it is producing the antibodies, it is involved in the humoral mediated immunity. Humoral immunity is due to the B cells because of antibody production, whereas cell mediated immunity is due to the T cells. T cells is involved in the mechanism. This protects mainly against the bacterial infection by the antibodies, and this lymphocytes having its major role in the viral infections and autoimmune diseases. The lifespan of lymphocytes is where T lymphocytes is very long. When compared to the B lymphocytes, it is very short. And the B cells have a major histocompatible complex class 2 MHC. Class 2 is present in the B cells, and here no MHC complexes. Among the B cells which is producing the immunoglobulin is IgD. It is the major immunoglobulin which is produced by the B lymphocytes. And the variations, lymphocytosis increased during chronic diseases, and infectious mononucleosis, which is the causative agent for infectious mononucleosis. Epstein-Barr virus, good. And during tuberculosis, syphilis, lymphocytic leukemia, diphtheria, and most of the urinary tract infections increases the lymphocyte count. And ACTH treatment, Cushing syndrome, anti-metabolite treatments, and during AIDS, lymphocytes will be decreased. That is why in case of AIDS, the CD4 count will be less than 20. Okay. And then monocytes, they are the macrophagic scavengers. Okay. It is having the major role in the phagocytosis process, and it also destructs the necrotic materials after the cell is dead. And among the monocytes, the B and T lymphocytes having the major role in the immune functions. Monocytosis in very, very chronic conditions, and in case of glandular fever and in case of malaria, you will see specifically the increase of monocyte count.